Details on this, we have Greg Gregorio reporting live from Mandaluyong. Greg, good afternoon. So, is it finally all systems go for the delivery of Astrazeneca vaccines from the COVAX facility?
Charles, good afternoon. According to WHO Country Representative Dr. Rabindra Bayasinghe, all requirements have been settled between the Philippines, the COVAX facility, and AstraZeneca for the expected delivery of 5.5 million to 9.5 million doses of AstraZeneca. Charles?
All right, Greg, when will we finally have that final date of delivery, and when are we expecting this, more or less?
Charles, according to Dr. Rabi, since all requirements have been settled, the COVAX facility may be able to issue the exact date of delivery within the week. Charles?
All right, within the week sounds good, but then how many doses are we expecting to arrive, and how many vaccine recipients are seen to benefit?
Charles, we are expecting 5.5 million to 9.2 million doses of AstraZeneca shots to be delivered to the Philippines. According to Dr. Rabi, these doses will come from South Korea, where the AstraZeneca shot is being manufactured, which is solely allotted for the COVAX facility. As to the number of possible recipients, we don't know yet, as this would depend on the final number of doses that we will be receiving. Charles?
Right, so we're still on wait-and-see mode insofar as that's concerned, but then we have Dr. Rabi explaining precisely why Pfizer asked for an indemnification deal, which actually led to a lot of delays, no? But then what did he have to say about this?
Charles, it was earlier reported that Pfizer asked for an indemnification agreement to have a certain level of immunity so that they cannot be sued for whatever severe adverse effects their vaccine may cause to those people who will be vaccinated with their shots. But it was later on clarified by Dr. Rabi that the indemnification agreement asked by Pfizer is also the same with the indemnification agreement asked by the manufacturer to all other countries, meaning it is not unique to the Philippines and it is not related to any previous vaccine-related issues in the country. Charles?
Right, there are certain proposals, Greg, to encourage tourism recovery by removing certain travel requirements. What does the WHO have to say about this?
Charles, according to Dr. Rabi, this kind of idea shall be carefully thought because the government would have to factor in the possible travel of an individual from a low risk to a high risk place or the other way around. Dr. Rabi said if this will happen, the government or the officials must effectively or efficiently impose the quarantine protocols that we are doing right now. Charles?
All right, looking forward to that update on the AstraZeneca vaccines. Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong. The Health Professionals Alliance Against COVID-19 supports President Duterte's call to defer the implementation of MGCQ in the entire country pending vaccinations. HPAAC's Dr. Maricar Limpin told One News' The Chiefs that the country is still not ready for a more relaxed quarantine classification. Limpin said among the reasons for this are the public's lapses in following minimum health protocols, such as wearing of masks or maintaining social distancing. She also noted the transportation sector isn't ready for the move. Limpin added that if the country prematurely shifts to MGCQ, then it's likely that the transmission of the virus will be much faster, and this could in turn drag the economy further.
If we do shift from GCQ to MGCQ, that will mean shifting the responsibility of protecting the Filipinos on ourselves na rin, ano? And the main question is, are we equipped enough or empowered enough to do it? So I don't think that we are actually ready.
The vaccine expert panel confirms that Russia's Sputnik V vaccine has already passed their evaluation. However, speaking with 1PH's W.H.O, lead vaccine expert Nina Gloriani said the brand has yet to provide a few more documents and information to the FDA for its emergency use authorization.
Ngayon, ang FDA po may hinihingi tungkol sa mga license to operate. Kung hindi sila makasubmit nun, hindi po maa-actionan ng kanilang application.
We'll be back with more stories after a quick break. Keep it here on One News. You're still watching One News Now. I'm Charles Lejano. As the country awaits the arrival of COVID-19 shots, health experts say there are still some myths and misconceptions regarding vaccines. The Philippine College of Physicians and Philippine Society for Microbiology and Infectious Diseases held a virtual health forum to address these concerns. Jen Kalimon joins us live to give us a rundown of what went on during this event. Jen, tell us, what particular myths about vaccines were debunked by the health experts this morning?
Yes, Charles, health experts shed some light on the false impressions or ideas pertaining to COVID-19 vaccines. Dr. Catherine Roa said that it is not true that a person cannot receive vaccines because of food allergies or allergies to inhalant, insects, because even patients with controlled asthma can receive vaccines. Patients with immunodeficiency and autoimmune diseases may also be vaccinated, but warns that there is no enough data available to establish the safety and efficacy in these conditions. As for the pregnant and lactating women, she said there is limited data on vaccines for pregnant. That's why it needs to be discussed with a doctor. For lactating women, they may choose to be vaccinated if they belong to the priority groups. She also belied the impression that a person cannot catch or transmit COVID-19 anymore after receiving the vaccine because we have limited information if the vaccine can protect us against asymptomatic transmission. It is also not advisable to use different brands of vaccines. The World Health Organization also recommends that same products should be used for both doses. Meanwhile, although survival rate is high, Dr. Roa debunked the idea that vaccines are not needed anymore because people might develop serious complications and it may also cause long-term health problems. Lastly, Dr. Roa debunked the idea that once vaccines arrive, the pandemic will be over. She said that it might take a while before we reach herd immunity, which will put an end to this pandemic. Charles?
Right, you mentioned herd immunity, Jen. What did they have to discuss at the forum as regards the role of the COVID-19 vaccine in this pandemic as the one that we're experiencing? What's the overall take of the group?
Well, Charles, the health experts are saying that we should follow the prioritization, prioritization scheme assigned by the task force for COVID-19. That's why LGUs must comply with the standards set by the government, and there must be a coordination first with the national government before they procure their own vaccines to achieve herd immunity, Charles.
Right, but should those suffering from COVID-19, for example, right now, get vaccinated immediately, or what if they're unaware and asymptomatic? Should everybody just get vaccinated right now?
Well, Charles, the answer is not right away because people who currently have COVID-19 should wait until they fully recover. Well, for those people who may have antibody treatment, they should wait for additional 3 months before getting the vaccine. Now, if the vaccinee is unaware and asymptomatic, he or she may follow first the minimum health standards so they can still be vaccinated Well, also part of the process during inoculation is that a person must sign a health assessment form first. So if a person has symptoms of COVID-19, he or she will not be allowed to get the vaccines as a precautionary measure. Charles?
Right, Jen, what did the health experts have to say about the various vaccines that are about to become available on the Philippine market? Did they make any recommendations on which COVID-19 brand could be used for public use, and as to why or why not?
Well, Charles, both Dr. Roa and Dr. Villanueva did not give a specific answer for this because the studies on these vaccines are still ongoing. Although there is an available data for its safety and efficacy, we have to see the results first after a large population is vaccinated. And then that's where we decide, that's when we will decide which vaccine is better than the other. But for Dr. Roa, in terms of efficacy, she said vaccines are all the same basically. So personally, she will get whatever vaccine is available in the country.
All right, Jen, did the
Charles?
health experts also talk about this so-called long COVID? And is this something we should be worried about, at least according to the experts?
Well, Charles, Dr. Villanueva said that she had few patients who recovered from COVID-19, but they are still complaining about lingering symptoms such as cough and shortness of breath. But when she asked for diagnostic laboratory procedures or results, she saw nothing wrong with it. So it's possible that these lingering symptoms were caused by residual effects that happened to a patient's body after getting the virus. Also, Charles, the age and their underlying health condition could also be a factor, so it varies from person to person, Charles.
All right, thanks for that, Jen. That was Jen Calimon reporting live from Malabon. Some jeepney drivers are crying foul over the steep penalties they suffer whenever passengers are spotted without face masks and face shields. Some are even calling on the IACT to penalize passengers themselves. To give us more updates regarding today's IACT operations, we have Justine Ponsalang reporting from Caloocan. Justine, good afternoon. What do you have for us?
Jeepney drivers are complaining about the penalties imposed on them when passengers are caught without face shields. They say it is unfair because traffic violation tickets cost more than what they earn daily. This morning, the Interagency Council for Traffic, or IACT, went to E. Rodriguez Avenue in Quezon City after receiving reports that many public utility vehicle drivers in the area are violating health protocols. According to IACT team leader Commander Reynarte Sargragao, they encountered the same violations they noticed in other areas, primarily the non-wearing of face shields of passengers inside jeepneys. Sagragao said that they have been repeatedly reminding drivers that they will be fined if their passengers do not wear face shields. And in their almost everyday operation, the IACT hope that jeepney drivers have learned their lessons. But whenever they flag down a jeepney, the drivers have almost the same response. They were simply not aware that the passenger was not wearing a face shield. And when IACT operatives issued them a traffic violation ticket, the drivers get angry for the high penalty that they have to pay. According to the IACT, the first offense costs 2,000 pesos, 3,000 pesos for the second offense, and for the third and succeeding violations, drivers will be penalized 5,000 pesos. One jeepney driver is hoping that penalties would be made more affordable. He said he only earns 200 to 300 pesos a day, and if that is not enough for his family's needs, how much more can he pay for a traffic ticket? Another driver went so far as to suggest that the passengers should be the ones penalized, or at least given some responsibility because of their traffic ticket, because after all, they were the ones who violated the health protocol. But Sagragao explained that it is the driver's responsibility to refuse a passenger who is not wearing a face shield. Besides health protocol violation, the IACT also issued traffic violation tickets to private vehicle drivers who are not properly wearing their seatbelts and motorcycle riders who are not wearing helmets. The IACT has already concluded their operation here in Caloocan after they have issued around 50 traffic tickets.
And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Just register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.